Hi, good evening. I'm Dr Strettle and I'm a GP at the Village Surgery in Rotherham. I've been a GP in Rotherham for over 10 years and I'm really excited to be here this evening to talk to you about menopause. This is a really exciting topic and there's lots to talk about and it's really nice to be here today. Now you might be wondering why it's me here in this seat. So I see lots of patients with menopause and hormone replacement therapy queries and questions. I also do lots of work for various different groups around the area. So I've been doing work for South Yorkshire Integrated Care Board and NHS England, and also with Rotherham Borough Council on menopause pathways, making things better for women. Just in case. Shall I start again? No. So I've also done the Diploma in Family Planning and Sexual and Reproductive Health, which is kind of a diploma of lots of information out there as well. I do need to mention though that it's actually incorrect in the advert that said on this that I do have a specialist interest in menopause. Officially I haven't done a British Menopause Society qualification, so I can't say that, so that was incorrect. So what I will do today is try and use the real life work and information that I know about to help you. I want you to ask questions, so any of those silly questions you've been thinking about menopause, about treatment, about things you want to ask. I'm a GP and I'm working all the time, and so I may not know the answer, but hopefully I can direct you in the right direction towards that as well. We may talk about intimate issues as well as part of this, so just to make you aware that might be there too. What I can't do is do necessarily specific clinical advice to individuals. I would always say go and see your GP or go to 111 if you want something specific that's worrying you dealing with, but feel free to ask and I'll see what I can do. So I suppose first of all, first question is what is menopause? That's probably a place to start, isn't it really? It's actually a diagnosis looking back in time. So menopause is actually when our periods stop, but that is looking back over a year of no periods. So actually we can't really say it's that until a little bit later down the line. So before then it's actually what we call perimenopause, which to be honest is the same symptoms really, it's just your periods haven't quite stopped then. They might have become more irregular. And all of these things are basically showing us when our estrogen levels are dropping and we're not making as many eggs anymore. And it's a gradual change over that time. And for most women, that will happen between the age of 45 and 55. And the average age in the UK is about 51. Symptoms wise, things that people might notice would be things like hot flushes, sweats, disturbed sleep, insomnia, low energy, low mood, anxiety, not necessarily having the same sex drive, memory not working quite as well, aches and pains, headaches, palpitations, and things like vaginal dryness. And of course, a lot of those symptoms can be linked into other health problems. So it's not always menopause that's causing those. So often if you go to a doctor, they might check for other things like thyroid problems too. And there are lots of different treatment options out there, and we can certainly cover some of those this evening if that's useful. Things like diet, lifestyle. There is of course HRT, complementary therapies. There's other medical treatments, and then there is CBT as well. Now then, I'm hoping to do some questions and answers, so I'd be really grateful if you could put some questions in the chat box. I can't actually see them at the moment. The questions have gone, so we'll just get those questions online and then I'll start to have an answer about any things you might want to ask me about. I suppose just to mention, lots of local things are available for help with some of those things I mentioned. So for example, diet and lifestyle. Locally we have, hopefully you can see behind me here, Rotherham Health Wave, and that can offer lots of help and support with diet and exercise and stop smoking, if anybody's interested in that too. We're just getting our questions coming up now, and I was just wondering if anybody out there has any questions they would like to ask about menopause or HRT. Please do ask away if anybody has anything they're interested in knowing about. If not, I will maybe start to answer some or talk about some things that lots of people may ask. So please do see if you have anything you would like to mention on there. So I suppose a question people often might go to their doctor with is, how do I know my symptoms are due to menopause? Because as I said, there's lots and lots of symptoms on that list, aren't there? So it's hot flushes and sweats and things like that. I suppose one part of that would be any changes in, is there changes in your periods? So if there's change in your periods and you're between the age of 45 and 55, then it's highly likely that there could be some link to menopausal symptoms too. Now, of course, that's a bit tricky if you're on any kind of contraception that might affect your periods. So in that situation, there's things that can be done to check whether that's part of the situation too. So great, we're getting some questions through now. So I can see there one, can I take vitamins with HRT? Well, that depends a little bit on the vitamins you're taking. So any kind of standard vitamin, like say vitamin D or a multivitamin, should be fine. But if you're thinking about more herbal supplements, you need to be a little bit careful with some of those. So for example, things like St. John's wort is a herbal medicine that people can buy from lots of health food shops. And that can interact with lots and lots of medications, so that one you need to be a bit careful about. But yes, a general multivitamin, and particularly in the UK we're all recommended to take vitamin D throughout the winter. That would be definitely recommended. Other questions we're having through here, oh great questions, let's have a look. So are there any supplements you can recommend before we get to HRT? That's a great question, well done. So supplements wise, so I suppose treatment of menopausal symptoms. So often the symptoms are those hot flushes and sweats. What can help those that isn't HRT? Because I think that a lot of people want to know that. What can I do to help myself? Actually, a lot of the healthy living stuff will help menopausal symptoms too. So having a mixed, balanced diet, making sure that you're having half of your plate containing vegetables when you're eating, not having too much fat in your diet. So definitely looking at what you're eating and trying to follow the kind of healthy government advice about that is really useful. Lifestyle wise, actually lots of things in your lifestyle can make sweats worse. So for example, if you drink extra alcohol, that can make sweats worse. So trying to stick to that 14 units a week, no more than 3 units in any one day. Smoking again can sometimes make menopausal symptoms worse, and there is help available to stop smoking via Get Healthy Rotherham Health Wave, and often some GP practices might offer as well the Vape to Stop as well programs. Weight management, so if you have a little bit of extra weight, a little bit overweight, weight can make sweats worse. So ways to help with sweats can be also looking into that, so getting a bit more active. Again, Rotherham Health Wave can help with that. There is also through Rotherham United Football Club, they do offer menopausal support and exercise as well through that, and that is available too. So all of those kind of healthy living things are definitely something to consider. Also, if people aren't keen on thinking about hormone replacement therapy, trying to adapt what you're doing day to day to make the symptoms more manageable. So some people might say, for example, have lots of thin layers on, so having a t-shirt and then a cardigan and then a jumper with a scarf perhaps, and then if you are having a hot moment, taking off some of those layers, or if you're sitting and working in an office, maybe sitting closer to the window if you're somebody who's struggling with the hot sweats. And being open about it. I think a lot more people are open to menopausal symptoms now, and having that open conversation about, you know, I'm struggling a bit today, I've got a bit of brain fog. I think there is that bit more openness about it too. Other things that are available as well, we know there is some evidence for cognitive behaviour therapy. So cognitive behaviour therapy is about helping you deal with the symptoms and problems you have at that time. So it's not necessarily about counselling, about going back in time. It's about how can I cope with the things that I'm dealing with right now. And there is some good evidence that CBT to help with menopause symptoms can really help. The local support for that is through Rotherham Talking Therapies. So I'll just show that there, and that is available throughout Rotherham for free, and you can call the numbers on that poster. And they do have a specific menopause support program where they do cover lots of topics related to menopause and coping and living with it. So lots of those things may help as well. So that was a great question there. So what other ones have we got? We've got a question here about, would HRT help with tendon issues, protection and repair? So HRT is hormone replacement therapy. As I said at the beginning, when you're going through menopause, estrogen levels drop. What HRT does, or part of HRT does, is it replaces the estrogen that has dropped. You also need progesterone treatment, and what that does is it protects the womb lining from thickening from the estrogen. So if you have a womb, you need the progesterone part too. But the estrogen part, what that does is it replaces those hormones that are dropping at that point in life. That mainly helps with the symptoms of hot flushes and sweats, and that's the kind of main reason for women to take it. There are some extra benefits which are nice. So for example, we know when estrogen levels drop in menopause that heart disease risk can increase. If people are on HRT, actually that protects the heart. Secondly, bone strength can go down, and the risk of things like thinning of the bones, osteoporosis, can go up after menopause. Again, HRT helps protect against that. So it's definitely known that it helps with those. When it comes to tendons, I don't know of any specific evidence that HRT helps with that, but we do know that it helps with bone strength and with heart disease risk. It's not a reason necessarily to take it, because there are risks with HRT which we can cover, but it is a reason to kind of think, oh well, it can be doing me extra good as well. So what else have we got in here in the questions? So we have there's a mention here about somebody being on HRT for quite a while and how it's been a real game changer. And there's some questions as well about weight gain and struggling with weight gain. And we know that that is a real problem for a lot of people, having kind of unfortunately weight is linked into many different things in our lives, and it is really hard to kind of focus on one thing to fix that. I suppose what I would say is we know people are more likely to be successful managing weight with support, and Rotherham Healthwave has lots of support available for that, and yeah, hopefully that's a good way to manage that too. There's some questions about hair thinning or loss. So there's a question here about any recommendations for hair thinning and loss. So I suppose that can be part of menopause, but there's other reasons why people can have hair thinning. So some of those reasons can be things like thyroid problems. So it would be important to think about having a thyroid blood test for some people if you've not had that before. Anemia as well and low iron levels can also cause that. So again, that's probably one way you'd want to go and have a full assessment. There are also conditions of the scalp where people can lose hair as well. So it may be worth going to a GP to have a check over with that as well. And there's one here about sleep is a major issue. HRT has helped with other symptoms. Lots in the press about magnesium supplements. Any thoughts? I have to say that's not one that I would know enough about to comment on. Again, the problem with a lot of supplements is the amount in them is quite variable, and a lot of herbal supplements and supplements from health food shops perhaps haven't undergone the same tests and checks that medications from the doctor will prescribe have gone through. So yeah, sorry, I don't know details about magnesium supplements there. There's a question here, is extreme fatigue part of menopause? And if so, are there any strategies to deal with it? So definitely tiredness can be part of it, I think, and low energy. So strategies to deal with that. I suppose if you were wanting to consider kind of hormone replacement therapy, that could be considered as part of the options for treatment if you're interested in that. And we can discuss a bit more about HRT if that's useful. Other ways to manage tiredness. So I suppose it would be important to kind of pace things through the day. We actually know having a regular sleep pattern really helps with energy levels, so making sure you go to bed at a similar time, get up at a similar time, try not to nap too much during the day, and making sure that you remain active. So even if you're tired, it's actually really good for us to try and do regular exercise. So maybe recommended is 30 minutes of moderate exercise 5 times a week. So that can be walking, it can be any sports class. Swimming even is really good. So all of those things can help with energy levels. And again, if you're not sure or haven't had a recent checkup, it may be worth going to the doctor just to make sure, particularly if you've had, say, heavy periods, that you're not anemic, or that your thyroid levels aren't abnormal, because that could also make you feel quite tired and fatigued as well. And there we go, there's a question about magnesium oil helping somebody with restless legs. Again, as I say, I wouldn't be able to say about that. Somebody here saying about, I'm on HRT, but I've got lots of joint and hip pains, especially at night. And I think that's kind of an issue, isn't it, with HRT. I think a lot of people hope that it will be the thing that fixes everything. And for some people it is completely life-changing, and that is the thing that they really needed to get them back right again. But it doesn't necessarily fix everything. And there can be, unfortunately, other conditions that can come on as people enter this kind of time of their life. So sometimes things like osteoarthritis, so wear and tear in the hips, can be a problem. And also, other health conditions. But actually thinking about some of the things I've said about general management of menopause can help too. So staying active can be really useful, and general health advice would help that too. There's mention here about so there's some mentions about HRT. Sorry, these are a little bit longer, these ones. So there's people mentioning about how people have been told that they have perimenopause, but they've been given some hormones, and that the blood test didn't point to menopause. And it is difficult, isn't it, that whole, what does the blood test mean? So maybe it's a useful thing to talk about when we do blood tests for menopause and when we don't do blood tests. So people over the age of 45 who come to a doctor with the typical symptoms of menopause, so that would be flushes, sweats, brain fog, low energy, anxiety, palpitations, maybe vaginal symptoms. If they have the typical symptoms and they don't have symptoms of other problems like thyroid issues or anemia, for them it's very, very likely to be either perimenopause if the periods are still happening, or menopause if there's not been periods for a year. So actually for those people, it is very likely that that's what the symptoms are, and it's not necessarily recommended over the age of 45 to always routinely do a blood test to confirm that it is menopause. Actually, it is possible, if the person's able to think about treating. The reason why we don't always recommend doing blood tests in that group, so people over 45 who are having the symptoms, is because the blood tests do vary, the levels go up and down quite a lot. So you don't always get an accurate result, so it can go up and down quite a bit. People who are under the age of 45 who are having menopausal or perimenopausal symptoms, for them it's useful to do the blood test, and we do 2 blood tests 6 weeks apart. Now the reason for that is that for those people it is a little bit more unusual, so only 5% of women go through menopause under the age of 45, so it's a little bit less common. So we tend to try and make sure, firstly, there's not another reason, and also we also check for other health problems as well and make sure that that's what it is. But over 45, that is, a really, we don't really need to do blood tests. So I'm not quite sure why they did repeat blood tests. It's always as well important to remember that with HRT, there's no perfect HRT for everybody. So as in, there's lots of different types of HRT, there's lots of different products available, and sometimes it takes a bit of time to find the right one for each person. So sometimes you might need to go back, try a different type of HRT, see if it works for you. And so those are all kind of things to think about. And if it did make a difference and you don't have a reason not to have HRT, then it's often worth seeing if there are different products that might be helpful for you. So what else have we got here? So there's a mention here. So you mentioned pills that can mask period frequency. What tests should be recommended to discover if you're in menopause for those people? So anybody who's on some types of contraception, so for example the mini pill, which is also called desogestrel, the injection, so that's the contraceptive injection, also known as Depo-Provera, the implant, which is a little rod that goes in the arm, or the coil, so the contraceptive coil, particularly the Mirena coil. All of those can stop periods. So the contraception itself stops you from making an egg and stops you ovulating, so you don't then have periods anymore. And so in those women, if they are not having any menopausal symptoms, there's no need to have a blood test. But if they are having lots of flushes and symptoms and there is a query about whether they could be menopausal, the reason at that point to check those blood tests would be to see, firstly, how long they need to stay on contraception. So when you've been through the menopause, and if you're over the age of 50, then you only need contraception for another year after that. So even though you'd think, actually, I've been through the menopause, I'm not going to get pregnant, actually you still need contraception for another year to be certain. So if you're on, say, something like a coil and you're not having periods, then some women want to know when they can actually stop that coil and have that coil removed or stop the contraception. So for those women having that blood test, they can say, okay, so it looks like I'm in the menopause right now. My blood tests are both showing that I'm in that menopausal range. And then 1 year after that, they can then stop the contraception. Now, they still may have the menopausal symptoms and need treatment of that, but at that point, they could then stop any kind of contraception. Under the age of 50, you need to wait 2 years after those blood tests showing menopause to say that it's safe to stop contraception at that point. So most of the time, the reason to do blood tests, if people are on contraception that's stopping them having a period, is to see when they can stop that contraception. But also, I suppose, if people are coming with lots of symptoms and they're not having periods because of the contraception, it can just help that person know what's going on. So in that situation, it's worth having a check. But as I say, if you're not on contraception and you're over the age of 45 and having the classic symptoms, actually that diagnosis can be based on the symptoms you're having and your age, and whether your periods are changing as well. So seeing some other questions here. Can I swap HRT patches for another method like sprays or oils? I struggle with them coming off in hot climates while on holiday. Absolutely, yeah. So that's what I was just saying. There's lots of different products out there. So HRT, there's two parts to it. So it's hormone replacement therapy. So you've got the estrogen part, and that is replacing the estrogen which has dropped in menopause. So in menopause, you have a low estrogen level, so the estrogen is replacing that. Now, if you have a womb and you just give estrogen to a person, then the womb lining can thicken, and that can result in an increased risk of womb cancer. So you have to give progesterone as well. Now, there's several different ways you can give those different hormones. So for the estrogen part, you can give the estrogen as a tablet, or it can be given as a patch, a gel, or a spray. So the tablet estrogen does have a risk of DVT with it. So if you take estrogen as a tablet, there's a small risk of having a blood clot in your legs called a DVT, or a deep vein thrombosis. So some women, if they've ever had a DVT or they don't want that risk, they're not advised to then take estrogen as a tablet. The safer way for those women is to take the estrogen either as a patch, a gel, or a spray. And so this little picture here that I'll show you has got the different types of estrogen that are available. So if I just show that up there, so on the top there we've got the estrogen spray, the estrogen gel, which is called Estrogel, and then we've got a spray which can be applied on the arm, and then the bottom we've got the patches. So yeah, absolutely, if you've had a problem with the patches coming off, then completely there is other options available. So the spray, that's this one here, is called Lenzetto. Literally, it's very easy, this one. Take the cap off like that, and then it's onto the forearm for most women, and that's between 1 to 3 sprays per day. That gives the estrogen part. And then you also need to have progesterone to protect that womb. And the progesterone, so if you're taking patches, then often the progesterone is included in the patch. If you're on the spray or the gel, then often you'll need to take a progesterone tablet as well alongside that. The safest type of progesterone tablet we tend to use is one called micronized progesterone. The reason for that is it's thought to be most similar to the body's natural progesterone, and so it's thought that that one is probably the lower breast cancer risk one of them. And it also can be slightly relaxing, so people take it in the evening before bed, and it can help them have a better night's sleep as well. So for the lady who's asking about alternatives to patches, yes, there definitely is, and they are for some people much better, and it is quite a personal choice. So some people like the idea of a patch put on twice a week, and that will allow them to take those, hormones, and not to think about it. Other people quite like the idea of nothing stuck on their skin. So if you're very active or you're going to sweaty places where you're going to be hot, then actually a patch could be quite annoying. So actually the spray or the gel might be more useful. What else have we got here? So somebody asking about, I'm in surgical menopause, so that means that basically at some point it sounds like this person has had their ovaries or some kind of surgical procedure to their womb or ovaries, which has meant that they've gone quite quickly into menopause. So for some women it happens just gradually, but if you have surgery to your womb or your ovaries, then suddenly it can make you go into menopause. And this person doesn't feel they're on a high enough HRT dose. So what's available out there for help? I suppose to make you aware, there is a limit in the NHS as to usually what most GPs would prescribe for estrogen amounts, and that is based on the British Menopause Society guidelines. So for most GPs within the NHS, we would only do a maximum of 4 pumps of the gel, 3 sprays of the Lenzetto, or 100 estrogen patch. And that is based on the British Menopause Society guidelines, which say that those doses are kind of the highest that are safe, and actually any doses higher than that could increase the risk of things like breast cancer to an unacceptable level. If symptoms are not managed on those, sometimes it's worth looking at the different preparations that are available. So if you want a spray, maybe trying a gel. If you want a patch, trying a gel, and so on, and changing around the types. Again, the progesterone can make a bit of a difference to symptom control. So you have the estrogen for the menopausal symptoms, the flushes, and the progesterone protects the womb. So sometimes changing the progesterone can help as well, if there's any side effects of the progesterone. And then if you're still not feeling that you're getting as far as you need to with that, then there are other options out there. So there is, for some women, testosterone can help. Now that is only used once people are on the right amount of estrogen, and that's usually a reasonable dose of estrogen. We don't use testosterone before then. Quite a lot of GPs wouldn't necessarily be confident using testosterone. Locally, there's 2 routes of getting extra support for GPs with extra kind of treatment levels about what next, and my symptoms aren't improving. So the Rotherham Hospital has a menopause clinic, and there's also a menopause clinic at Sheffield. Now there are quite long waits for those, often up to a year or 2, but GPs can write to those clinics for advice. As I said at the start, I've also been doing some work with NHS England, and it does look like in the next, hopefully, year or 2, there will be some more options available for GPs to get support with cases where women aren't having their symptoms controlled. There's going to hopefully be something called the virtual hospital, where GPs can refer in, and there will be specialists there who can reply back within a few days, often directly to the woman. So I've been involved in the pathways trying to make that happen. So for the time being, I would say go back, see what other options are available, see if you want to try some of the other HRT preparations, so the spray or the gel or the patch, and then see if you can get it up to those top doses and see how that helps. And then, as I say, GPs can seek advice from the local menopause specialists at the hospitals if we need to. And yeah, somebody's very cleverly mentioned there about the HRT prepayment certificate. Yeah, absolutely, that's a really good comment. Thank you for mentioning about that. So from about 2 years ago, if you are on any kind of HRT preparation, you can pay a one-off charge, which I think was around £19, and that includes all of your HRT products for a whole year. So it's a bit like a prepay, but only for HRT. So it's quite a lot cheaper than having a prepay for other medications. It only covers HRT related products. So it only covers things like estrogen, progesterone, and I think it does cover as well if you're using vaginal estrogen as well. So that is a really nice thing though, because it does make it a lot cheaper, because otherwise most of the time most people would get 3-month prescriptions of these kind of medications. Some practices might only do 1-month prescriptions, so and that would be £9-10 per product, so you might be paying £20 a month, whereas obviously the prepay is £20 a year, so it's much cheaper for that. I was just looking on the YouTube ones as well, seeing if there's any other kind of questions in here. So other questions on here. One here, at what point would you recommend medications for insomnia? So I suppose it's hard to know whether you're meaning here general medications for insomnia or HRT for insomnia. So medications for insomnia generally are not recommended. So unfortunately, a lot of the medications generally used for sleep problems don't work very well. Your body becomes used to them really quickly, so they become what we call, your body becomes tolerant to them, and so they stop working, and often they don't result in much increase in refreshing sleep. So we generally say that actually medications for sleep are not really recommended. There are lots of other products and things out there. So on the NHS website, there is a whole section on sleep and apps that can help. There are various apps out there and programs on there, and actually there's some really good evidence behind the cognitive behaviour therapy sleep support out there. So things like Sleepio, there's another one called Sleep Station. Some areas I think that is funded, not necessarily in every practice, but that's something maybe to consider. If it comes to insomnia related to menopause, for some women HRT could help with that, but again you would want to be probably thinking of all of the symptoms of menopause and seeing whether the insomnia was part of those, but it could potentially help with that. I probably wouldn't recommend that you took HRT just for poor sleep. You would need to have other symptoms of menopause as well for it to be worth the small breast cancer risk. And maybe it's worth mentioning about that breast cancer risk right now. So menopause obviously is really debilitating for some people. Up to 25% of people have severe symptoms. So for some women, HRT is life-changing. But there is a small risk of breast cancer if you take HRT. And that's particularly as you get older and as you're on HRT for longer time periods. We know, unfortunately, breast cancer is common anyway. It's the commonest cancer in women. But being on HRT, particularly for those longer periods of time, does put that risk up. And if I just show this kind of, this is what I show my women when they come and talk to me about HRT. So this little summary here just talks through what you might see with breast cancer risks. So we know that in women aged 50 to 59, about 23 cases of breast cancer are diagnosed per 1,000 women in the general population. Now, if women are on combined HRT, so that's the estrogen and progesterone, which most women will need, there's an additional 4 cases of breast cancer. So that is a small increase. Now, in this also, so this is the BMS guidelines, and we will put a link on to this if anybody wants to see it. In this, though, it's also important to look further down. So if you're a smoker or you drink, say, a large glass of wine every day, actually that is putting you at similar risk to being on HRT. So it's important to bear that in mind. The other thing also is actually, if you see lower down here, having a BMI, so weight over 30, again puts you at much higher risk than HRT. So while HRT does have that small breast cancer risk, it's important also to remember the other lifestyle factors which factor into breast cancer too. And actually, if you minimise those, so if you stop smoking and look after your weight and try and reduce the alcohol intake, then actually that can be really beneficial for your breast health. And so it's all about that individual decision for that woman about, for them, whether the risks of HRT, that small breast cancer risk, is worth the benefits. And so coming back to insomnia, I suppose that's why in insomnia we wouldn't necessarily recommend that HRT is the treatment to use for it, but it could be an option as part of all of the treatments of menopausal symptoms. Right, so some other questions on here. Can you have vaginal estrogen as well as using Everil Sequi? And that's a really, really good question. So yes, is the answer, most definitely. Everil Sequi, if anybody doesn't know, that's Everil Sequi is an estrogen and progesterone combined patch. There's 2 different patches in the packet. So you get 2 weeks worth of estrogen only patches and then 2 weeks worth of estrogen and progesterone. The estrogen and progesterone part, particularly the progesterone part, protects the uterus, so stops you from getting womb cancer. The estrogen part that's there throughout the month is the bit that helps with menopausal symptoms. Now that will help with the flushes and the sweats and the kind of lots of the menopausal symptoms people are having, but it will have some help for the vaginal health. But we know actually this is definitely an area people don't talk about. So in menopause, lots of women have vaginal dryness, vaginal discomfort, increased urine tract infections, and that's often because the vagina is very sensitive to estrogen levels. The patches will make some difference to that, but actually vaginal estrogen can be really, really helpful. And there are a few different products of that as well to be aware of. So we've got a little tube of estradiol cream, so that can be put on down below, and you literally can pop a little pea-sized bit on your finger and use that down below. Most women would start with that every night for 2 weeks, and then they would go to maybe a couple of times a week. It can be used every single day. The amount that gets into your bloodstream from using that, even if you use it every day, is equivalent to 1 HRT tablet in a whole year. So even if you use it every single day for a whole year, it's only equivalent to taking 1 HRT tablet. So the amount that gets into your blood from that is very, very small compared to the amount that you're putting on in your skin in the patch. So yes, they definitely can be used together. And there's really good evidence that it can help with vaginal health and also reduce things like urinary tract infections. So yes, definitely they can be helpful for that. Particularly useful as well if people are having prolapse symptoms, so a dragging sensation down below or having kind of a heaviness down below, because actually the vaginal estrogen, if that's a bit low, again, having some vaginal estrogen to boost those levels can make the skin down there much more healthy. So the different ways of applying it, as I said, there's a cream, there's also a little tiny tablet you can put in down below, and there's a range of different ones of those available. You get a little applicator like that, a tiny tablet just goes in the end, and then that can be put in a little bit like a tampon down below, and that releases slowly. Most people have put it in before bed at night, and then that can slow release as well during the day. These are available on prescription only. There is one that's available over the counter for these products, and it's called Gina. So that's actually available now, and people can go to any pharmacy. They'll probably ask a few health questions first, but then you can buy that. So you don't even need to see a doctor to get Gina. And so that's a nice option as well. A bit like HRT, so HRT, hormone replacement therapy with estrogen progesterone. You've got your vaginal estrogen options too for vaginal symptoms. All of those for most women are probably fairly safe, apart from if you've had breast cancer, or if you've had a recent stroke or heart attack. In those situations, often GPs will need extra advice. Often it may not be safe. So whenever you're thinking about these products, it is important to seek advice, get support. Don't use your friends' products because it might not be suitable for you. Even though they are available over the counter, again, the pharmacist will have to check whether that's safe for you as well. Good question here. When do I know when it's time to stop HRT? There isn't a right answer here. It's a very individual decision, really. So starting HRT, quite an individual decision. You're balancing whether the risks of breast cancer versus the benefit to symptoms is worth it for you as an individual. So that's one thing to think about when you're starting HRT. The longer you've been on the HRT for, the risk of those breast cancer risks do go up. And there is a really nice little guide on the NICE decision aids about looking at those risks over time. So we can put a link to that in the feed as well. And that will give you just some idea of, for me, for how long I've been on this medication for, what are my risks of breast cancer. Because that's something people always want to be thinking about probably, and that's something that every year when a person goes for their review on HRT, it should be part of the conversation. So most people every year would have a review and see, have their health conditions changed? Are they monitoring their breasts? Are their blood pressure okay? Is everything kind of working well for them with the HRT? So one reason to think about stopping would be that the person's decided that they've had it for a few years now. They've got through that period of time they want to try without it, and we would usually recommend slowly weaning it down over a period of time. Another reason for stopping could be if somebody developed something like breast cancer. So if that happened while taking HRT, they would need to stop at that point. Similarly, if somebody then had a heart attack or a stroke, again, they would need to stop at that point. Often then it would be possible to involve menopause specialists, but we would need quite a detailed conversation. But most of the time for breast cancer, that would be a reason to stop. For other women, it's that risk benefit. And I do know older women who stayed on it for a very long time, because for them, it makes a huge difference to their life and quality of life, and they understand the risk of the breast cancer, but for them it's so crucial to them to be on it, and it's made such a difference to their quality of life that they're prepared to take that risk. So it's a conversation between yourself and the specialist about the GP about what's right for you, and looking at those kind of risk information things as well. Good question here as well. Do I still need the pill when I'm in menopause? So I don't know if you heard the bit before, but so when you're going into menopause, you may already be on contraception, so you might not know whether you're in menopause or not, so blood tests can help at that point. Under the age of 50, if you haven't had periods for 2 years and you're not on any kind of contraception, at that point we can say that you don't need contraception. Over the age of 50, if you've not had periods for a year and you're not on any kind of contraception, then we can say that you don't need contraception beyond that. Now, obviously, if you're on contraception already, and that's every type of contraception apart from the combined pill, then as I was saying earlier, you probably need a blood test to confirm whether you could be menopausal or not, and that's 2 blood tests 6 weeks apart. And then if you're under 50, you'd need 2 years of contraception and then you could stop. If you're over 50, you'd only need 1 year. HRT is not contraception. So HRT helps with the menopausal flushes, but it doesn't stop you from getting pregnant. So it's still really important to have that contraception alongside HRT, and you can take them together. Now, there is some types of, so there is one type really of contraception that can be used as part of HRT. So if you remember, I was saying that the estrogen part of the HRT helps with the flushes and the sweats, but we need the progesterone to protect the womb as well. Now, the only type of progesterone that we can use that covers both contraception and HRT is the coil. So we have the Mirena coil. So this is a hormone-based coil, little tiny thing like this. It sits in the womb doing its job. So this is a little example of the womb, looks like this. It sits in the womb doing its job, releases a hormone, the progesterone hormone, that would prevent pregnancy. It also can make periods lighter and less heavy, and it also can cover the womb for the progesterone part of HRT too. So some people really like that idea because then they're doing it all in one. So that's a really nice option. Most women can have a coil unless you've got kind of a very different shaped womb, or if you've had certain health conditions, but lots of women can. Lots of general practices across Rotherham do fit coils, and if not, then the gynecology department at Rotherham Hospital can do it as well. And then if you've got that coil in for HRT, for the progesterone part, that can last 5 years. So that covers you for both as well, which is really useful too. And then at the end of that 5 years, if it's working and you're still needing the HRT, it can be taken out and a new one can be put straight back in. It's not the most comfortable thing to have one put in, but it's short, so it lasts about 5 to 10 minutes for most women. It's like a bad period cramp type pain. But then once it's done, as I said, it's in for 5 years, and most women get on really well with it, and that gives you both. So that gives you the progesterone cover for the HRT to prevent womb cancer, and also the contraception cover. None of the other types of progesterone contraception, so the pill or the implant or the injection, none of those give you enough progesterone to be able to protect you with HRT. So if you're on one of those types of HRT, you need to take HRT progesterone on top of that as well. I hope that makes sense. So let's just see what other questions we've got coming in here. So there's somebody mentioning the app called the Balance is good for logging symptoms. Absolutely. And I would say that's really the benefit of apps these days, isn't it? You can log your periods, so you kind of know where you are. You're becoming perimenopausal. Are those symptoms changing? That's really useful, isn't it? And often people might notice in that perimenopause time that their kind of symptoms may link to their periods too, so they may notice that hormone change and feeling a bit low and not feeling themselves in those few weeks before the period. And that's quite useful, isn't it, for you to know when those periods of time where you might not be feeling great. So yeah, apps are brilliant, aren't they? And there's loads of good stuff out there too. There's some nice websites out there too that have lots of information too. So there's one called Rock My Menopause, which is really good. And there's also some really nice websites. So the one that doctors use is called the British Menopause Society. And they have like a patient part, which is called Women's Health Concern, which has really good quality information in there too. Because that's the other thing you've got to be careful of. So there's a lot of money in menopause, really. And there can be people out there who may want to take a lot of money from you for not great advice. So just make sure that you're getting good quality information. So if you're going to go and pay to see somebody, make sure that they've got a British Menopause Society qualification. Your GP should really be able to, give you good quality advice on this, or at least know where to look if they don't know. And there's lots of other good quality information out there on things like the NICE guidelines. So that's the National Institute of Clinical Excellence, has the kind of decision support tools to look at, so that you can look at things like, what would my risk of breast cancer be if I was on HRT for 5 or 10 years? So apps are great, aren't they? And there's lots of good quality stuff out there too. So that's a really nice comment. Thanks for that one. When do you know it's time to stop HRT? Is this the year after period stop? As I say, there's no right answer to that. So some women find HRT so life-changing that they want to stay on it. Other women say, well, I just want to have it for a few years. When you stop HRT, even if you do it gradually, you will get a few flushes and sweats. And it's dependent on that person as to whether it's manageable and it's okay, or whether actually the HRT was worth still being on. Often we would slowly reduce the amount of estrogen, so you don't suddenly drop the estrogen levels, because that's often what makes people feel particularly sweaty and not well. And it is quite a personal choice about what the right time for that person is. As I said, if somebody suddenly developed breast cancer or a big heart problem, you might have to stop, but the rest of the time it's a personal decision as to when the right time for you is. So it's not necessarily that you have to stop it 1 year after periods. It's when it's the right time for you and when that benefit and risk is the right time for you. And so every year most women should be having a review, if you're on HRT, of that HRT, looking at your health, blood pressure, any new health conditions, the doses of the medications, whether they're working well for you, whether it needs to be changed. So for example, if you were taking oral estrogen, but for example your blood pressure's gone up, you'd be safer moving on to estrogen as a patch or a gel or a spray. So it's having those kind of reviews to make sure you're on the best treatment for you. I've got a question here. I am on 1 milligram estrogen and I've tried 2 milligrams with worsening symptoms. Would testosterone help? It depends what the symptoms that were worse were, to be honest. So estrogen, that's the estrogen tablets been mentioned there, is the part that's helping with those menopausal flushes, sweats, sleep, aches and pains, energy, anxiety, those kind of things. Sometimes increasing the dose of estrogen can cause, increase of other symptoms. So we know for estrogen, side effects wise, you can get symptoms like fluid retention, breast tenderness, bloating, nausea, headaches, and so adjusting the dose for those things can be helpful. The thing that testosterone mainly helps with is sex drive and libido, and usually you need to have the optimum dose of estrogen first, and that's usually the higher doses of estrogen before you would consider testosterone. Reason for that is that in the UK at the moment, there aren't really any testosterone products that are what we call licensed to be used. So a license is when a medication has been checked by the drug company that make it to make sure it's safe in a certain group of people. At the moment, that hasn't happened for testosterone for women, for HRT. So we don't really have a product that has the kind of agreement that it's safe as such. Now, there's lots of guidelines out there that have looked at testosterone for women. So the British Menopause Society has released guidelines about that. In Rotherham, we have a local guideline about it. But because of that, we're cautious to use it because there is some information, but we haven't quite got as much. And as I said before, so some GPs who've done perhaps extra training would consider starting testosterone, but we have to have people on a good dose of estrogen first. Some GPs perhaps wouldn't feel confident with that and then actually would get involved with the local gynecology department or menopause clinics to get the support to go for that. What would you usually say is if the increase from one dose to another dose of estrogen didn't feel great, it may be worth thinking about a different route of that estrogen. So actually, would you be better on the spray or the patch or the gel? Because actually they're often there's a bit more choices in the doses of those. So the tablets often have 2 doses, so 1 or 2 milligrams, whereas the spray, you've got 1, 2 and 3 sprays a day. The gel, you've got 1, 2, 3, 4 pumps per day. So the gel is dosed by pumps applied on the skin. Most women would start at 2 pumps a day, but it can go up to 4 a day. And the patches, the starting patch for most women is a 50 strength, but it can also go all the way up to 100 strength. So there is quite a lot of different choices with the different products, and some people find that there's less side effects with the different products. So I think if you've struggled with not being quite right on different doses of one type of estrogen, it may be worth trying a different type of estrogen before you go for testosterone. Testosterone, as I said, helps with sex drive and libido, but it can have side effects. So it can cause increased hair growth, it can cause voice change, it can cause your clitoris to get larger. So it can affect you in other ways. So it's one that it can help some women immensely, but equally it has to be used in the right situation, and the other bits have to be sorted first. I hope that's helpful. Somebody said that's useful, and keep asking these questions. That's what this is all about, because if you've thought of it, somebody else has probably still got that same thought too. So ask away. There's no silly questions. So there's a question here. Is it usually true that you follow in the footsteps of your mum in terms of when menopause starts? I assume this is irrelevant if your mum was triggered due to surgery, and so it's a surgical menopause. Yeah, so surgical menopause is a funny one. So if you've had an operation that affects your ovaries or your womb, often that puts people into menopause in a different way to normal. So yes, it wouldn't usually then follow that your family members would have similar. But if that's not the case, so if your mum has had menopause that was early, often that does follow. Doesn't always, but often does. Similarly, if you had periods that started early, again, that can often follow through families. So often, yes, if it's not linked to surgery, that can be part of the case as well. Lovely. I've just seen if there's anything else. We've been looking at things. So it says, how long is the referral to the menopause clinic, please? So there's several ways of accessing that extra support for GPs. So often GPs can write to the menopause clinic to get more information. So I've done that definitely for women, particularly if, for example, they've had breast cancer. In that situation, often we need information from their breast cancer specialists, their surgeons, and the menopause clinic. So you can write to those people and get answers back, but that can take a few months often. But if it's coming to things like we're talking about testosterone, some GPs might not be able to do that. Actually being seen in a menopause clinic, I believe at the moment the wait time for Sheffield is about 2 years. I'm not sure about the local Rotherham one. I think they've just created a new clinic, but again, the waits are often a year or so at the moment. But, go and ask your GP, and, often within a practice, there will be a few GPs in there who have done some more work on this or are particularly more trained on it. And I think it's reasonable to ask, is there somebody in the practice when I'm booking an appointment that is particularly good with dealing with menopause and HRT? Because there will probably be somebody out there. As I said, I've done some work with Rotherham Borough Council about menopause and contraception for women in Rotherham. And so I put out across Rotherham and got the names back of lots of GPs across the area who are interested in these things, so contraception and menopause, and it covered most of the practices. So out there are people who are really interested in this. It's often the people who might be fitting coils, for example, because they will be doing that extra bit of kind of knowledge and information. So it's well worth asking when you're booking your appointment, is there somebody who particularly could help me here? Or even the person you're seeing, is there somebody in your practice who knows a bit more? And as I say, they can refer you on to those clinics, or they can get advice as well. And that's called advice and guidance. I hope that's helpful. I've just seen if there's any other ones here that is useful. It's for everyone to discuss about. Any other questions are very welcome. Lovely. So I suppose just some general chat about menopause that is useful perhaps for us all to know about. So people often ask me when they come in to see me, will this fix everything? Will all my kind of problems with menopause go away when I start on this? Will I feel like completely normal? Often people do feel quite a bit better. It's not instant though, so often it takes a good few weeks to really notice a major difference. And for most women, what we would recommend is giving it that 3-month period of time to see how they feel on it. So 3 months of treatment, and then see at that point. And most women would start on kind of a middle dose of estrogen to give it a reasonable chance of working, but also not too high a breast cancer risk, and then see at that point how they're doing. Another question coming in here, is it usual to have symptoms like hot flushes for a few weeks and months and then stop before starting again? Absolutely, that is normal. So in the perimenopause, that's the lead up to menopause, periods often become more irregular, so you don't tend to have them quite as often. And because of that, the estrogen levels, instead of going down all the time like in menopause where you just don't have the estrogen there as much anymore, the estrogen levels often vary and go up and down quite a lot. And that in itself can cause, when there's not much estrogen around, lots of flushes. And then actually when the estrogen sorts itself out again a bit more, then the flushes settle. So yes, absolutely, it can vary like that too. And like I said before, actually, diet, lifestyle, other things going on in life can affect it too. So if your weight changes, or if you are going through a particularly stressful time, that can affect things too. And like I said before, actually, we know that CBT can actually really help menopausal symptoms too. So that can be a really kind of another way of dealing with those menopausal symptoms too. Another question that I get asked a lot about, and often comes back to me, is about bleeding on HRT. So it depends a bit when you start the HRT as to whether you need to have a period or not when you're on that HRT. So if you've still been having periods and then you're given HRT, then you need to continue to have those periods for at least another year. So what often happens for those people is they're given a type of HRT where they will take progesterone for 2 weeks of the month, and then they'll take estrogen all the time. And that will mean that they will have a period once a month, but they should only have it once a month. And then it just helps us all know when that period's going to be. After a year or so, if that period has either stopped or the woman wants to try then to not have periods, we can then go to estrogen and progesterone throughout the month, and that should then mean that the bleeding stops. Whenever somebody starts HRT or maybe switches to a different type of HRT, they can have for the first few weeks or so a little bit of different bleeding. Now, if somebody's been very stable on HRT and not been bleeding at all, but then they suddenly start to get new bleeding, so say they've been on the type of HRT where they have estrogen and progesterone all month, and then they suddenly start to have bleeding when they hadn't, that's a concern, because suddenly that means that something in the womb is different. In the Rotherham area locally, there is a process then for us being able as GPs to request an urgent scan, because what we want to see and check is that the womb lining hasn't changed at that point. So what I would say, if you're starting on HRT, in those first month or two where you start it, it can be normal to have a bleeding that's a bit different. If it goes beyond 3 months and then the bleeding changes and you start having bleeding all over the place, or you weren't bleeding and then you suddenly start bleeding, you need to go and see a doctor at that point. So you need to have that bleeding checked out. And it's really important that whenever you're on HRT, if you've got a womb, that you do take that progesterone just to prevent that risk of womb cancer. The other thing to be aware about as well is if you stopped periods and you're not on HRT and you're not on contraception and you have no periods for a year, and then you suddenly start bleeding again over a year after your last period, again, that's not normal. So you need to go and see your GP at that point, because that needs an investigation to check your womb is okay. So just keep a good eye on your health as well. And similar to that, when you're on HRT, we advise all women to be breast aware. So a bit like I was saying on the HRT, there is that small increased breast cancer risk. If you're taking the HRT, do just keep a general eye on your breasts. So we say, ideally, gently lying back in bed once a month with a flat of your hand, just check all the areas around the breast. So we say work in a clockwise motion all the way around the breast, and then also remember to go up into the armpit as well. So the breast tissue goes all the way up to your shoulder and onto your armpit. So just have a gentle check, have a little look in the mirror, check that the skin on your breast looks normal, check your nipples look normal. If there's changes in the skin or lumps or something you're not happy with, again, go and see your GP and get that checked. And also, if you're invited for mammograms, if you're on HRT, really important to get those mammograms done. So it just makes sure that you're keeping yourself breast aware, which is what the recommendation is at the moment. I'm glad that this is a really useful one. So, as mentioned here, can ovarian cyst trigger or cause perimenopausal symptoms? Not strictly speaking that I'm aware of. So cysts are, so every time you make an egg in your ovary, you can make a cyst. Lots of women that happens for, and lots of women never knew they even made the cyst. Occasionally cysts can be painful or large, or people can bleed into those cysts. But the cysts in themselves, unless they are very large or they're kind of having a major impact on the ovary, don't tend to cause people to have perimenopausal symptoms, and actually a sign that you are still ovulating and having estrogen present. So not to my knowledge is that part of it. Let's have a see. So there is a person here saying, I had a check for the BRCA gene before I took HRT, which is currently available to women of Jewish heritage through the NHS programme. Well, I didn't know that it was available in that way. That's really useful to know, and that is definitely a consideration. So when somebody comes to me for the first discussion about HRT, things that I would chat about with that person would be, first of all, what were you hoping to get from the HRT? So what is it from your symptoms that you hope would help? What health history have you got? So have you had a stroke or a heart attack? Have you had any liver problems? Have you had any major breast issues? And what family history have you got? So have you got a family history of breast cancer? Have you got a family history of BRCA? Other things that we like to know about is those lifestyle things. So like I was saying, what's your weight? Do you smoke? Do you drink much alcohol? Do you have any things like migraine headaches? Again, as I was saying before, if you have some of those risk factors for, say, slightly overweight, smoking, migraines, we would be much happier you considering the estrogen that's through the skin, and that would be part of that first assessment. Often we would do a weight and a blood pressure check at that first assessment. People with high blood pressure can still have HRT, but we would usually like that blood pressure to be well controlled before the HRT was started. So I have had women come to me who are on blood pressure treatment. They come for their HRT review and their blood pressure has gone up a little bit. Often I would then say to them, oh, look, we really need to get that down to make sure that this HRT is as safe as possible for you. We just don't want the risk of stroke with HRT. So, those are the things that we would look at that first assessment. But yeah, you're right, it would be part of an assessment, and that's really useful to know, Amber. Thank you for that one. And there's one lady here who said that she's been prescribed lots of different types of HRT, patches, gels, and she's still trying to find the right dose. And she says that it's completely changed her personality. She was quite confident and capable, but she now feels quite different in lots of different ways. Yeah, and I think she said there, just keep going back to your GP. And I think you're right. So there is a real drive in Rotherham at the moment to make this high up the agenda. So last year I was at the Rotherham Council Health Select Committee, and there was loads of people around the table. So there was councillors from Rotherham Council there, Rotherham Health Watch, that's the kind of people promoting health for people who are having problems in the area. Rotherham United Football Club was there. There's representatives from Rotherham Hospital. There was myself there as a GP representative, and other kind of lived experience people around the table. And there was a real push that, you know, this is something that needs to be in workplaces. There was definitely a conversation about how it was really important that everybody is aware about menopause. It's not just about the woman, it's about their family, it's about their work, about adapting to that, about making sure that, for example, you know, if you are in an office, there's an option to sit close to the window. There, you know, there's variable heating on, that there is an appreciation that it can be a problem for women and that that's okay. So I think there is that real awareness out there, and I think it's great that, you know, Connect Healthcare are doing these new live streams, and the first one they've chosen to do about is menopause. So, you know, people want to know about this stuff, people are interested in it. And also, as I said, so across nationally, there is a new virtual hospital that's going to come hopefully in 2027, where GPs will be able to refer into menopause specialists directly. So yeah, there is a real kind of thirst, isn't there, for people knowing more and understanding more about menopause. And I think it's a bit like maybe contraception and periods. You know, it used to be we didn't talk about these things, but actually people are now, and that's great, isn't it? Because we should all be talking about it. And yeah, I think the mental health bit, as I said, it is coming, isn't it? I think it wasn't always necessarily there and people didn't appreciate it. As I said earlier, the Rotherham Talking Therapies does have, as I said, a specific menopause workshop where they do offer lots of support. And I was actually even emailing the people before I came on today, and that is live at the moment. So they have got regular menopause workshops where they talk about menopause, sleep, and a bit of peer support as well, I think, from other people in the room. So yeah, there is help out there, because we know that it's not just about medication, is it? And it's also a time of life when women can be dealing with a lot, changes in career, elderly parents potentially, children moving away from home, lots of different things going on in life. So it can be, you know, a tricky time to balance a lot of things, can't it? So I think appreciation of that as well. But CBT has had really good evidence that it can help with that as well. And yeah, I think people find that personalities can be quite different and change, and there's, you know, a lot out there, isn't there? But I think, you know, it is something that everyone's becoming more aware of now. And I would say, as I said before, so keep asking, and, you know, go back to your doctors if you're not quite sure about what you thought about before. All of this has been recorded tonight, and I think it's going to be available in segments. We're going to put on the links of all the links and things that are available, and things that are out there to help. So hopefully that will be really helpful for everyone as well, to still be able to look at that as well. And yeah, I suppose it's a mixture, isn't it, of trying to find the right medication if that's right for you. Also, where you can, you know, try and do those bits of help you can yourself as well. So, you know, Rotherham Health Wave, loads of good support there that's available locally for healthy living, diet, exercise and so on. So get that support. And as I said as well, Rotherham United do offer a menopause support chat as well. So they have information in chat sessions too that are available again. So there is lots of resources out there too. Let's see if there's anything else there. I'm glad that's all really helpful. I mean, please do keep asking things. I mean, other questions people ask me when they come into my room. So I've got a little list here of things, so I'll just talk through some of those in case they're useful. So what else have we got in here? Benefits of HRT. So as I said before, HRT isn't the right answer for everyone. So if you've had breast cancer, often it's just not possible. But if you've not had that and you are don't have any other major health risk factors, then it can have the benefit both for the symptoms, and as I said as well, it can also help cardiovascular, so heart health, and also bone strength. And how can I work out if the HRT is right for me? It's a mixture of what are your symptoms, how disabling are they, how much are they affecting you, is it menopause that's causing your symptoms? So actually it's important to think about other problems, as I said before. So could it be thyroid issues that's part of the problem? Could it be other health issues like anemia that need to be looked at? So it's important to bear in mind the other situations too, and if it is right for you, It's about having a try of kind of a standard dose, isn't it, and seeing and giving it that 3-month trial. And some people come back to me after that and go, actually, you know what, I stopped it, wasn't right for me, didn't like the side effects, not for me at all. Other people say, oh, actually, you know, I feel quite a bit better, but I'm not quite where I want to be. And at that point, we would look at changing the estrogen dose, or if they've had problems with it, we might try other things. So we might try adjusting the estrogen or trying different doses of or different types of progesterone too. So lots of kind of different things out there, isn't there, as well, which can help. I'm just trying to see if there's anything else we've not really covered that could be useful for everybody out there. And yeah, I'm just seeing if there's anything else. Is there anything else people want to ask about? Please go ahead if you've got anything. Oh, that's very sweet. Somebody saying it's been really useful. Well, you know, this stuff is out there. I did the GP training, so it's been about a year and a bit ago now. I did a similar kind of session for GPs on all the kind of management and things out there. We're continuing to do that work through Rotherham Council as well, and hoping that we will get more and more GPs on board, because a lot of the simple bits of HRT all GPs can do. It's out there, that information. When it comes to testosterone, GPs might be a bit more nervous about that, but straightforward HRT is, you know, for most GPs is fairly bread and butter stuff. There's somebody asking about, I've been on HRT for a year, could I stop and go back on? That's a really good question, because I think people think, how do I know when I'm ready to stop? You can stop it. The issue is if you have a longer duration of time off it and then go back onto it, it can actually cause problems with in your blood vessels in your heart. You can get destabilization of the little bits of cholesterol in there. So we usually say if you're going to stop it and think you might want to go back on it, don't stop it for too long. So maybe 1 or 2 months, see if you're okay without it. If you're fine, that's it. But if you have a long period of time off it, so say over a year off HRT, it's actually not ideal to go back onto it. And it's actually safer to start HRT within 10 years of menopause. After that, the risks of actually causing more heart problems. Now, I know I said earlier that heart problems are actually less with HRT, but that only applies if it's started within 10 years of menopause. Actually, if you go longer beyond that, it's not as safe. So ideally you start it around those ages when you're going through the changes. You carry on with it as long as you feel it's necessary for you. You have that risk and benefit discussion. And then when it's right for you to stop, you would slowly wean down the dose and stop it. Some women choose to look at other things at that point, so herbal supplements and other kind of lifestyle measures. If you were to try stopping it, but then found actually, no, I really, really miss it, I would say don't wait months and months and months to go back to it, because actually that's that problem where you can get that slight destabilization of those plaques. That's the cholesterol deposits in your heart. So don't wait too long in between. So would having FND be a contraindication to starting HRT? Sorry, tell me what you mean by FND, just so I know there's lots of shortenings out there. If you want that to be discussed on here, remember this is a public forum, so you may be better going to GP, but if you want to put it on there, you can. So I'm glad it's all been helpful. Let's have a look at some other bits and bobs that might be useful. So we talked about kind of abnormal bleeding, and generally the message about kind of safety and longer term is try and get the lowest dose of estrogen that helps. So as I said before, you need to get onto quite a higher dose of estrogen before you can think about things like testosterone. But actually, if you don't need those higher doses of estrogen and a low dose of estrogen does the trick, that will probably be better for the breast cancer risk. So go for the dose that helps and keeps you stable, but there's no need to try and go for really high doses. There was some controversy in the past about clinics, private clinics sometimes giving really high doses of estrogen. As I said, NHS GPs generally won't do that. It's just not thought to be safe. And so we go by what the BMS, so the British Menopause Society guidelines say, and the maximum doses they recommend, because that's where the safety is felt to be. So yeah, asking about things like functional neurological disorders. Again, it would need to be a conversation between you and the clinician. But the only kind of complete reasons not to have HRT are breast cancer, strokes, heart attacks. So, as long as you don't have those conditions, it would be that conversation back and forth, looking at your health history, your medications, to see whether those things could be an option. So yeah, I hope that's useful. And yeah, there's all sorts of things, isn't there, out there as well. I think we've talked about kind of the different types of HRT that are available. The only other thing to bear in mind, as I said, that most women would start on a type of HRT where they have a period each month, and then over time, when they've been more than a year on that type, or in the future, they would then move to where they have the estrogen and progesterone throughout the month. Some people quite like the idea of keeping on having periods. Don't know why, but they do. And for those women, that can continue for a certain amount of time. But we know after 5 years on that type of period where you have, on that type of HRT where you have a period, there is an increased risk of womb cancer. So eventually, it is safer to go to that kind of continuous HRT where you have both types of hormone all the time. Other things just to bear in mind, I think we did mention a little bit about this, but I think just remember your vaginal health as well in all of this. So as we spoke about before, so HRT as the patch, the gel, the spray or the tablet is helping your whole body with the estrogen levels, but the vagina is super sensitive to estrogen. You will get some benefit from those HRT products on the skin, but the vaginal symptoms for most women can be really, really horrid, and the vaginal estrogen can make a huge difference to that, and it can be really good for things like lumps or bleeding or kind of all problems down there. Now, if you are having bleeding down below and you've not had periods for a while, you must always get it checked. If you have any lumps or bumps or sores that aren't feeling right, again, you must get that checked. But for things like dryness, pain on having sex, going to the toilet more often, having lots of urine infections, actually vaginal estrogen can be really, really helpful. There are other causes of skin changes down there, so people can get eczema down there as well. They can develop things like diabetes, which can make it sore too. And we generally buy simple things like avoiding wet wipes, things like all the Veggie Fresh type soaps. All of those can irritate. Just plain water is all your body needs down there, and actually if you wash and overwash down there, then that can actually make things a bit worse. So we say generally just be a bit careful on how many products and things you put on down there. Anything with perfume or bubbles is not meant to be down there, so just plain water is the best. But sometimes people do want to think about using these vaginal estrogen products. As I said, you can get them sometimes from a chemist. Again, and I would hope the chemist would ask this, but we wouldn't recommend vaginal estrogen if you've had a history of breast cancer or any kind of cancers down below, so vaginal, cervical or ovarian or womb cancer, or we'd at least need to consider that carefully. So, do seek advice, and you may need to see a GP if you've had any of those kind of cancers before it's considered, but they can be really, really helpful for some women for those. So, there's some more nice questions here. So, for how long can women be on HRT? So, I think we've spoken a bit about that, but that it's very individual discussion. We know that breast cancer risk goes up, particularly when women have been on HRT for more than 5 years. There are in the NICE, so there's something called the NICE guidelines. In the NICE guidelines, there is a decision aid, and it has lots of charts and tables in there that gives you a bit more of an individual risk of what your personal risk at different ages would be of breast cancer, if you're on HRT or not. And then it is a personal decision about what the risks of the HRT would be, so that breast cancer risk, versus how much of a life change it's had for you. So how much does it help with the sweats and the physical symptoms? And if it's still really helping, and you're not having any problems with your breasts and your blood pressure is still okay, it is that annual conversation about, is this still right for me? Is it still making a big difference? Do I want to have a few months trying without it and see how I am? Or do I want to keep taking it? And there isn't a perfect answer, and it's a very individual decision about what's right for that person. Some people come and ask about, well, what if I could switch to a kind of a herbal medicine or something different? Problems with herbal medicines is some of them do have ingredients in which are quite active. So the isoflavones, which have got things like soya-based products, actually do activate estrogen receptors. So we don't really know the details about what risks that could cause with things like breast cancer. St. John's wort, again, is a herbal product, but again, it interacts with lots of medications like epilepsy medications and blood thinners. So you have to be a bit careful with those other options too. There are some people who consider things like antidepressant type medications instead of HRT, but we've got to remember that people who are menopausal aren't necessarily depressed. It's often part of menopause that they're feeling like that. So it's important to look at all the options too. But for some women, if depression is a big feature of it and they don't want HRT, then that could be an option for treatment too. And there's a question here, is the bleeding that you have on HRT a proper period? So it depends what you call a proper period, really, I suppose. So what a period is when the womb lining sheds. Now, either you can have a period because your body it's made an egg, the egg hasn't been fertilized, and then your body is then getting rid of the womb lining, and that can happen naturally through the range of hormones that happen, or it can be made to happen by taking either HRT or contraception. So I suppose, strictly speaking, the bleeding is happening because the hormones are coming from a different place rather than from your own body, but it is a normal period in that it is a bleed that is coming from the lining of your womb like a period would do. So if you were on that first year of HRT, so say you've had a period within the last year, you've been started on HRT where you will have a bleed each month, that bleed should be once per month, and it should be similar to what your normal periods are. If you're having problematic periods, so heavy, painful periods coming up to this time, you may want to consider having a coil instead of having progesterone as a tablet or a patch for the HRT, because actually the coil can do all of it in one. So the coil can treat the heavy periods, the pain, sometimes for some people, if it's related to womb pain, it can also cover the womb for the HRT too. So that can be a really nice option that kind of helps with everything. But coming back to the question, is the period a normal period that you have on HRT? It's normal in that it's bleeding coming from the womb. It's not normal in the fact that your body is being made to have it because the hormones it's being given are making that happen, but then it needs to happen like that. And the reason that we give people that type of HRT where they have a bleed regularly when they first gone to HRT, if they've still been having periods, is that if we don't do that, then you'll probably start bleeding all over the place. And the problem comes then is we don't know if that bleeding is related to the HRT or if it's a problem with the womb. So that's why when you first go into HRT, you might start with having that type of HRT that gives you a regular bleed. And then when you've had that for a year or so, going on to HRT that stops the bleeding completely. You might have a little bit of bleeding at first in the first month or two of that, but then that should stop completely. And then if you were to bleed at that point, then we know that that's not how it should be. And that's the thing that we're always being a little bit careful about with HRT. And again, one of the things we check when women come for their review is, have you had any unusual vaginal bleeding? Because we don't want to miss any womb cancers in there as well. Another question here, at what age is HRT usually prescribed up to? I'm 55 and have been taking it for around 9 years. Again, this is a really individual discussion and decision, isn't it? So we definitely know if people go through very early menopause, so under the age of 40, they should take it up to the normal age of menopause. And that's got a different name actually. So if you go through menopause below 40, it's called premature ovarian insufficiency. And those women need to take the HRT right through to 51 at least. At other ages, usually women would often take it to that average age of menopause, 51. And then if you've been on it for 9 years, so as I said before, there is the nice decision aids on HRT, and in those there's lots of little charts that have, these are your risks for having been on HRT compared to not HRT and how long you've been on it for. And that can help you make a bit of an informed decision about, okay, at what point for me does that breast cancer risk start to get unacceptable? And there isn't a right answer, because some people say to me, look, I've been on this for 10 years or longer, I'm in my 60s, but for me this is life-changing and it makes such a difference to my life. I feel so much better able to cope with things. Yes, I know I have that, small risk of increased breast cancer, but for me this is so life-changing, I want to continue on it. And I think you remember as well what I said about on that chart as well. So if you have a BMI over 30, or you smoke, or you drink more than a large glass of wine a day, then actually that can be as or more risky than HRT as well. So you've got to remember, do all the other good bits too to help reduce your risk of breast cancer, and then that will make it perhaps safer to stay on the HRT if you can do all the other bits to help your health too. So there isn't a right answer there really about when to stop. It's when it's right for you really to stop, and when that risk and benefit level's not right for you anymore. So let's see, what else have we got here? cancer connection. So yeah, we've spoken a bit about that. So there's a person here asking about coming off everything due to cancer. I'm taking nothing. Is this right to do, or worse, taking nothing? Now, if that's breast cancer, then for most women, HRT is just not possible anymore. So even if it's a hormone receptor negative breast cancer, there's still increased recurrence if you go on to HRT. So most women, I'm afraid, they just can't have HRT anymore. In some areas of the country, there are very specialist clinics where they hold a meeting with all of their breast cancer specialists to try and see if it's possible, because menopausal symptoms can be so disabling. Locally, we would need the menopause specialist to get input for that, to have that pros and cons discussion. If you've had breast cancer before, there will probably always be a risk, though, if you went on HRT, that it would come back. So that's difficult. Other options we have, if you're not having HRT, some of the herbal options aren't great, so they can interact with the breast cancer treatments. Some of the antidepressants can interact with breast cancer treatments. Some of the safer ones you can consider, so there's a medication called venlafaxine, which for some people can be quite useful, although locally it's not the antidepressant of choice. It is a personalised discussion. There are some options that can be considered. Often HRT would be something that would be quite difficult to use in that situation and would need a lot of help and input for that. And yes, there is a mention of prevention of urinary tract infections by vaginal estrogen, absolutely. So we know that if you have a lot of vaginal dryness, or you're symptomatic down there, or having a lot of urinary tract infections, then actually, yeah, as you rightly said, so vaginal estrogen can be really, really helpful. So yeah, I hope that's all really useful in there. Is there anything any other burning questions anybody's got in there? I think we've got most of the stuff that people have been asking through the day. I suppose the message overall is, get help with this. If you're having symptoms of the menopause, you're around that age, your periods are changing, and you're really struggling with it, think about the simple health things you can do. So have a look at Rotherham Health Wave, get some help with your diet. Think about stopping smoking, alcohol. Think about ways you can adapt your life. There's the iApt support through Rotherham counselling services. They're available. They do menopause workshops too. Rotherham United offer that as well. And then if you're still struggling, come see your GP. Have a look at the information we put in the links today about the British Menopause Society, Women's Health Concern, and the other links that are available. Research what you might like first, because that's always really useful for me when somebody comes and says, look, these are the symptoms I've got. The GP may want some blood tests to check for other causes if you're over 45, to make sure you've not got a thyroid problem. And then you can have an informed discussion about the pros and cons of that kind of HRT at that point. And hopefully, if it's right for you, it'll make a big difference. And keep an eye on your breasts, and do seek advice, as I said, if you do start to get any unusual bleeding that isn't normal for you. And I think that's everything.